Thank you for the opportunity to share my research. In the past decade, artificial intelligence and machine learning driven models have been developed at faster rates than ever before. But development of these clinical tools does not equate to real life implementation that is both successful and equitable in improving health outcomes. Our study will focus on this algorithm to identify patients with peripheral artery disease, or PAD, using electronic health record data in order to increase the value and quality of care. This is the population rounding workflow used, which allowed identification of preventative interventions by an interdisciplinary team before a personalized message was sent to the patient's primary care provider. The two primary aims of this research was to one, determine facilitators and barriers to efficacious and equitable implementation, and two, evaluate differences in stakeholder aspirations. In total, 12 stakeholders were interviewed across 3 stakeholder groups. Here are the major themes we identified. Representative quotes can be better read in person at our poster. The first theme, facilitators translating in silico model performance to real world efficacy. Factors here include strong clinical leadership, having trustworthy workflows in addition to a trustworthy model, proactive consideration of the end user needs, and ensuring that the model identifies a problem that is both actionable and would change clinical management. The second theme identifies barriers to real world implementation. This includes having limited electronic health record dependent data, being able to incorporate on the ground contexts such as social and environmental variables, and lastly, having timely feedback loops from the end user, the primary care provider. Our third theme sought to explore what potential barriers there are to advancing equity. One is prioritizing impactable patients with limited time and resources available, missing social context, which becomes especially important for equity, as we know that clinical factors are by no means the only variables that are shaping an individual's health status and health outcomes. Invisible vulnerability, which may widen equity gaps by consistently underserving those that are invisible to the model. And lastly, insurance restrictions that leverage different resources for patients with different insurance plans. In conclusion, complexity is inherent to clinical AI implementation, and the interdependent factors that influence its success are best managed by appropriately resourced teams where all stakeholder groups are engaged meaningfully. Equitable outcomes don't just happen. They require careful consideration when implementing clinical AI in patient populations, especially with respect to gaps in data incorporation and health system structures. Visit us at our poster for more insight on stakeholder group comparison and more in-depth thematic analysis. Thank you.